Life on the road it's good, and but I tell you, once you do it, for a period of time, it get old. I tell you,
The last 3 years, I've gotten to travel with Morris, everywhere. I think I enjoy it more than he does. I haven't done it as long as he has, so. Morris, I think, had an episode where he got a hold of some bad food on the road, and you just never know what's gonna happen.
This big old sandwich, man, like it'll cost $20. It was so big. Got into that thing, man, that thing had me balling up in knots, and I think I'd like to have been took out by a sandwich.
What if one of us got really, really sick on the road and, you have to go to a hospital and nobody knows you there, then what? I'd feel like probably a total idiot. I could answer, basic things, but as far as, tests and allergies or, all these different things and medications and strengths and how many times, I can't remember all that stuff, especially, when you're worried and, you don't know what's going on, you're in a new place and things, that's a scary thing.
We do, as physicians, worry about doing harm to patients because we don't know enough about them when they come into the emergency room setting. And it is a very real danger. Data shows that somewhere between 1 in 5 and 1 in 10 patients that come into the hospital have a major complication related to their care. I've seen many patients who've had a problem with a drug allergy and yet have been given that drug a second or even a third time because doctors didn't have the records available showing that they'd had that drug allergy in the past.
I think all physicians practice with missing information every day. It's where it is. The prescription that the patient was given somewhere else last week, but they can't remember the name of it. It's the lab test that was done in another clinic last week, but it's Friday afternoon and they're closed on Friday afternoon, so you can't get it. So you go ahead and make the best decision you can without little bits of information that you would like to have.
As an information technology person, as someone who's been in healthcare all their lives, I struggled with that because I thought to myself, gosh, have we failed? It's very frustrating. And for me, it's frustrating from the fact that I hoped that throughout my career we could dramatically change. We've miniaturized circuitry and computers, we've developed software at a tremendous pace. Now, can't we do that to healthcare?
This is why providers across the U.S. are turning to health information exchanges. HIEs, as they're known, provide secure online access and routing to patients' charts among a network of providers. Hospitals, clinics, doctors' offices, and pharmacies join an exchange so they can have timely electronic access to records their patients will allow them to share. For patients, this means having their medical records available no matter where they go. And for providers, it means having instant access to life-saving information when seconds count.
I've practiced medicine in a lot of different settings over the course of my life. And I think it's very hard for a member of the public to understand just how hard the job of a provider is. Let's take, for example, a provider in the emergency department, and you come into my emergency department and you're critically ill. I've got to solve a puzzle, and I've got to solve that puzzle quickly. Now, in the old days, what you had to do was solve that puzzle with paper. You had to hope and pray that the person could tell you enough information about their health, or you would call a relative, or call a practitioner's office, or call a pharmacy and get enough information to solve the problem. And you never really could. You could get enough information to feel very comfortable that you probably weren't going to do much harm, but it sure wasn't efficient. And it sure wasn't in the best interest of the individual being cared for, not having all that information. You know, when you read about errors and the other things that can also cause harm, it's because providers, well-intentioned as they are, don't have the information they need. So health information exchange has changed this dramatically, because with health information exchange now, when I see you in my emergency department, I can get pretty quick access to all the medications from your pharmacy. Sometimes I can get access to all of the medications that you take at home, the over-the-counters and the like. I can get access to those allergy lists. I can get access to those notes from your other providers. I can get access to those laboratory reports and see what happened in your other hospitalizations. What is that scar? What did that mean? Oh, it was an appendectomy back in such and such a year. All of that just put together. I just move these pieces here, 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 and I put them together and I solve that puzzle very quickly, very efficiently. Now, another way that health information exchange solves a puzzle is if you then go back and see your primary care practitioner. Quite often what takes place in the exciting atmosphere in an emergency department isn't transmitted well to that provider. But with health information exchange, the minute you come out of that emergency department, you come back into my provider office in your outpatient setting, that information is right there like that. And so you take the piece here, take the piece here, take the piece here, take the piece here, boom, you solve the problem again and you go on. That's really important for primary care. As you know, primary care providers are under a lot of pressure these days. They have to see a lot of patients. They would much rather spend their time talking to you about what's important to your health, what's important to your life, than trying to go around and get an information here, get a fax there, fill out a form here, get a request there, and put the puzzle together. They would much rather talk about you and make from that puzzle a greater thing about your better health.
In emergency medicine, it's just revolutionary, actually, because we've never had patients' whole records, or it's been very, very spotty if at best. This gives us a lot more information so that we can actually elevate our game and do a much better job than we would have been able to do previously.
But how much access should providers have? Patients still want control over who sees what.
Today, as a patient, if I choose not to tell my provider something, I've made that choice. In an electronic world, there's a lot of fear of having that taken away. And so I think the electronic world has to, at a minimum, has to allow consumers to have that choice as well.
In the last 5 years, hospitals using Memphis, Tennessee's Health Information Exchange have saved $10 million from fewer admissions and fewer tests. But the number of lives saved and mistakes avoided is immeasurable.
Oh, sir, how are you? Hey, my name's Dr. Nichols. I'm the emergency room doctor. I understand you're having a little difficulty breathing, is that right?
A lot of difficulty.
Yeah? Tell me about it. How long's that been going on?
Off and on for 2 years.
And we just got called overhead for a 85-year-old shortness of breath, so perfect example of where, you know, he may not be able to give me all the medical history that I need in order to be able to make a decision. So you've been running any fevers?
Need to be running a little bit.
Yeah, you having some chills, kind of some rigors?
Yeah, during the night.
He's got a complex medical history. He's been in multiple different hospitals. But I really need to take a look at his medical records, see what's going on. Because at this point, I don't know if it's pneumonia, I don't know if it's heart failure, which can both give you shortness of breath. He's had metastasis to bone, so he's had cancer that's gone to different areas. Is there something else that could be going on today? All that information I wasn't able to garner from the patient, but I have to know that information to be able to make the right treatment decisions right now. Mr. Holderbaugh. Hey, sir. I was able to review your medical records. There's some important things in there that we looked at that's going to change a little bit on what we're going to do today. But it took me 3 minutes of going through a medical history of all the different hospitals to be able to formulate a treatment plan for this gentleman immediately and be able to get him on the right track. Otherwise, I'm waiting for test results that are going to take me an hour and a half to 2 hours, maybe even 3 hours. That's a luxury of time I don't have.